Hi guys, welcome to Arike Agbebe Clinics. I'm Ayorinde by name. I'm a registered nurse midwife. This clinic is a special one and a unique one. You will ask me why. Because in this clinic, we'll be educating you, we'll be giving you information, full information as regards to pre-pregnancy phase, pregnancy phase, which is antenatal phase, labor phase, postpartum phase, that's after delivery, then care of a newborn, also care of a child from 0 to 5 years. So I want you to follow me and you need to subscribe. Why? So that you can listen, you can get to my updates every time I update, every time I upload, then you can get to it. Then don't just subscribe, you will need to like, to share, then you comment below, then press on that notification bell so that anytime I upload, you'll be able to get my videos from time to time. Why is this clinic so important? According to WHO in 2020, it was estimated that 5 million children of under 5 died from preventable and treatable causes, and approximately 2.4 million occur among the newborns. And also, in every 2 minutes, this is even the major concern one. In every 2 minutes, a woman die as a result of pregnancy or childbirth. When pregnancy is supposed to be a thing of memorable thing, it's still a thing of tragic and real concerns that is happening among women, of which is not supposed to occur. So this clinic is a very special one. Here, our aims and objective is to reduce maternal and child mortality, which is mother and child mortality. We want to reduce it by educating you, informing mothers, informing everyone. It's not even a matter of mother, informing everyone of how we can go about it. Then also to reduce maternal and child morbidity, also to improve the health of the family as a whole, then to improve the health of everyone to prevent illnesses at all costs. So this clinic is a special one. You get belle, you don't get belle, you be bachelor, you be spinster, you be father presently about to be. It concerns everyone. It's a fight that we must fight together to stop a mother and a child from death at all costs. So today we'll be talking about a very important topic that will be entering antenatal phase, that's pregnancy phase. So we'll be talking about one of the major important topic there, of which is danger sign in pregnancy. Today we'll be talking about danger signs. So danger sign are the sign that when it occurs in pregnancy, it calls for prompt and emergency attention. When it occurs, you need to go to the hospital immediately. And our aim is prompt attention is the major thing. By the time you are able to attend to it urgently, we'll be able to reduce child and mother mortality and in their deaths at all costs. The first thing is headache. When we're talking about headache, you've taken paracetamol, it's not working. You've tried to take your bath, it's not working. You've tried to sleep, it's not still working. Please and please don't stay at home. You can be assuming that it's stress, it's malaria. That's our mentality, most of people's mentality. But when you have this kind of headache, please go to the hospital. If you take a paracetamol, please and please don't stay at home. Go to the hospital. So another thing we're talking about is blood vision. Blood vision, we call it blood vision. Blood vision in the sense that you notice that you can't see clearly. It's somewhat cloudy. So please and please go to the hospital. It's not that you are feeling as if you want to faint, but it's just clear. Please go to the hospital. Another thing we'll be talking about is vomiting, severe vomiting or severe diarrhea. A pregnant woman that will vomit 3 times, 4 times. In fact, some will not even vomit up to 3 to 4 times before they start getting weak. Do you understand? So if you notice you are vomiting like 4 to 3 times in a day, please and please go to the hospital. Or your own diarrhea, please and please go to the hospital. Because by the time you start vomiting excessively, there will be loss of electrolytes, and before you know it, you'll be weak. And your baby is less concerned. The nutrients they are to get from you, even if it's not adequate to your system, they will still get it. They will leave you with nothing. Will just before you know it, you'll be very weak and you'll be able to do anything. So please and please, if you notice severe vomiting, severe weakness, please go to the hospital. Another point is chest pain. We call it chest pain. You can be having chest pain or you're having chest tightening. Please and please, when you notice that, please go to the hospital. At any time you're having chest pain, please go to the hospital. Another thing is fever. Yes, it's a very major concern. If you notice that a pregnant woman, you are feverish, your temperature is so high. Do you understand? Please and please go to, don't assume that I'm having malaria. It's malaria, it's stress. Please and please go there. When you get to the hospital, they will tell you if it's malaria or it's not. So please and please, if you are having fever, please go to the hospital. The another thing is that if you're having this fainting attack, before you know it, you fainted, before water on your head, please and please go to the hospital. Don't assume. As a pregnant woman, you don't just assume. And it is not written on the forehead. You might be a primate, meaning that it's your first time of getting pregnant, or this is not your first time of getting pregnant. Danger sign can occur in anybody. That is it. It can occur in first timer, it can occur in somebody that is not first time and second time. In fact, it doesn't know customer. That's just it. It can occur in anybody. So please, if you see all these danger signs, you need to go to the hospital. The other thing that is very important is that if you notice reduced fetal movement or no fetal movement, no baby movement, you see, please and please, this one is very important. A child that will die in utero, that will die in the uterus, will not just die. Go possible. It will not just, the baby will not just die. The baby will definitely give the mother a sign. And one of the signs is that it will tell the mother the movement will be reduced. If you notice that before, your baby's movement used to be like 7 times, 8 times in a day. But now, it has reduced to like 4 times, 3 times, 2 times. You can say that, okay, is this baby sleeping? You are not to assume that the baby is sleeping. Come to the hospital, we are the one to tell you that the baby is sleeping. So when you get to the hospital, we'll check you, we see your baby, we'll notice, we do scan, we do some tests for you. We notice that, okay, your baby is okay, the fetal rate is okay. So from there, we'll be able to tell you, okay, maybe then maybe the baby was just calm, was just resting. So you are not the one to tell us, you are not the one to decide. That's what I want to say. So please and please come to the hospital. The another thing is that you notice lower abdominal pain. Lower abdominal pain radiating to our back. Please and please go to the hospital. This one I'm talking about lower abdominal pain before 37 weeks. Before 37 weeks is 10th baby. That is a mature baby. So, but below 37 weeks, you are not yet 37 weeks. You are not yet 9 months. Do you get it? And you're already having lower abdominal pain that is relating to your back. Please and please go to the hospital. It's very, very important. And if you notice water breakage before 9 months, it's a danger sign. Is a very dangerous sign that you need to go to the hospital. The water might just come it might just come once, or you just coming small, you just feel like, is it that I urinate on my body? No, you did not urinate. It's the water that is leaking. That is, and the baby is inside the water, in uterus. The baby is inside the water. So if you notice water breakage before 9 months, please and please go to the hospital. And before you go there, just apply a pad, then go to the hospital. Then if you notice blood per vagina, blood is coming out from your vagina, please and please go to the hospital. It might come very thick, it might come small, because it's spotty. It might come small, or just come thick like my hand, like this, my face. Please and please go to the hospital. If at any form of blood at all you see, please go to the hospital. You might think, okay, some people say it's placenta implantation. Fine. We are the one to tell you that it's placenta implantation. When you get to the hospital, we'll let you know that it's placenta implantation. Because it might not be placenta implantation sometimes. It might just be a placenta abruption. Maybe that the placenta has ruptured. So please and please go to the hospital and let's confirm that, okay, it is this. See that swollen face? I used to imagine some people, they will tell you, this pregnancy is really doing you well. You are really fine, you are beating my sister, you are not fine. The face look the nose look. Please and please go to the hospital. The puffy face, you notice that your face is so puffy, your hand, you can no longer use your ring again, your hand is so enlarged that you can't use your ring again. Please and please go to the hospital. Your leg is swollen. Please and please go to the hospital. And that leg swollen, it can be in 2 ways. It can be physiological and it can be pathological. Physiological, I mean, is that, when a woman is pregnant, the pregnancy, the stomach will begin to expand. And if the stomach is expanding, it will compress. It will press on that pipe that carry blood, those pipes that carry blood from the lower part of your body to the upper part. So as it's compressing on that part, all the fluids will not go up. So there will be accumulation of fluids downwards. So if you notice swollen leg, one thing you can do first at home is that you can raise your leg on a pillow when sleeping on the bed. Then another thing, as a pregnant woman, when you are sitting, your leg should not be hanging on the floor. You should raise your leg on a chair. Do you understand? You must sit down and raise your leg on a chair. So as a pregnant woman, when sitting down. So if you've done all these things and it's not still working, please and please come to the hospital. Then the last one, if you notice convulsion, is it that convulsion? A woman that will convulse will not just convulse. Ask me why. Because it will have given was some sign of which I've mentioned before. The first thing is headache. The woman will be having headache, persistent headache that is not going. You've taken paracetamol. You've tried to sleep. You've tried to take your bath. The thing is not still going. It's just doing back. Please and please go to the hospital. That convulsion, when it results to convulsion, is a sign of is a sign of what we call pre-eclampsia. In fact, it has resulted by the time convulsion occurs, eclampsia has occurred. Do you understand? So of which we don't want. And when it comes to convulsion, it can affect the mother or the baby. And those are the things that can cause maternal and child death. That is mother and child death, of which these clinics have come to board, of which we are trying to reduce at all costs. So please and please, if you notice all these signs, any of these might be one, it might be two. Do you understand? It might not. Don't wait to all these signs. If there might be any of the signs, if you notice any of the signs at any time, please and please, it's very important that you go to the hospital immediately. You don't have to wait for your clinic day. You don't have to wait for, in fact, when you see any of the signs, you don't have to go and call your neighbor or go and report to your neighbor first. The first thing is that, please, in fact, you need to go to the hospital. As you are going to the hospital, you call help. That is how it is. You call your husband, okay, I'm going to my way to the hospital. Please meet me there. I've noticed this. I've noticed one of the danger signs. So please and please, when you notice any of the danger signs, please don't forget. Prompt attention is very, very important. Prompt attention to danger signs will save both the mother and the child from death, which is our major goal. So until we meet next time, I remain your young baby. Bye for now. Bye.